general anesthetic. So it is all the modern inhalation anesthetic agents are all derivatives of ether. Ether was the next to chloroform. Ether was the most popular agent in fact, in our when we were postgraduates, we were all trained with only ether and trilene, trichloroethylene. Very much later, after almost 5-6 years after we qualified, halothane came. After the advent of halothane, for a long time, it was only halothane available. Then sevoflurane came. I mean, isoflurane came into market. Then sevoflurane came. Then desflurane came. So, but they are all derivatives from the original agent ether only, which is a clear non-inflammable liquid with a strong odor at room temperature. It is structurally identical to isoflurane. You mentioned that point, except that the substitution of fluorine atom at the fluorine atom of the alpha ethyl carbon. So this is the structure of isoflurane. You can see there is a chlorine atom here. And this is the structure of desflurane. So the chlorine has been replaced with a fluorine atom. So this is the basic difference. If you can remember to draw this structure in your answer paper, you will get definitely better marks than simply mentioning this sentence alone. So, and it is very easy to remember. You just put one cipher and then go for two arms on this atom. And one side 2 fluorine and the other side you have to go for this 3 fluorines. One fluorine extra, I mean fluorine attached here and fluorine coming replacing the same thing. So I don't think it should be difficult to remember this and draw this picture. And this fluorine's relatively low boiling point makes it extremely volatile, and in the presence of dry desiccated carbon dioxide absorbent, particularly barium hydroxide absorbent, and at high temperature, it gets converted to carbon monoxide. So the two basic requirements how it can get converted to carbon monoxide are the soda lime should be very much dry without moisture. And if it is barium hydroxide, that is barrel lime instead of soda lime, it is more reactive. And the temperature should be at least 45 degrees centigrade. If these two conditions are met with, then there's a possibility that desflurane can become carbon monoxide, and that will produce more delayed recovery because of the poisoning that it can produce. Okay, so whereas it takes place only with the absorbent and not with the inside the body metabolism, does not cause this problem. Now this is what I told you about how the bottle is manufactured. Now this is the original bottle by Baxter, which is 240 ml quantity with a specialized filling cap here. This is called the bayonet cap, so that it will go into the specified locking system. And this is a later version. This is the amber colored bottle. Now, by looking at these two bottles, can anyone say what is the difference between these two bottles? Why this bottle is looking little grayish and why this bottle is looking like a real amber bottle? Both are by the same company only. Baxter only produced this. This is the original Baxter preparation. This is the later Baxter preparation. So can you tell me what is the difference between these two? This is a plastic coating over the glass bottle. So if you break this plastic cover, then you will find this color, the normal colored bottle here. This was the original manufacturing. But later they had the good quality, thicker glass bottles available. So they stopped manufacturing this, and now they are presenting it in this. So the original manufacturing of desflurane bottles, they are presented only in a regular conventional bottle with a plastic coating, so that even if the bottle is dropped or specifically damaged, there is no explosion happening because of the plastic cover. So that is what you have to remember. And this is the filling port specifically attached to that. This is what is called the, anybody knows the name of this? that black thing that you see at the top. It's a closer picture of the arrow mark that is shown here. This is called the O-ring. Okay, Desflurane bottle with a O-ring. That is the arrow which is showing there is the O-ring. And sometimes this O-ring can get damaged. If it gets damaged, what will happen? When you try to fill the bottle, the whole liquid will come out, or it will get spilled out. It will not fill the evaporation chamber. So you have to make sure that this O-ring is intact when you try to use this bottle. And this is the Omida Datex Omida Tech 6 vaporizer. Of course, this is all not for your answer for this question, but from practical point, I thought I will add. So, how do you fill this vaporizer? Anybody have used this vaporizer in your practice or in your training?
Yes.
How do you fill this vaporizer? Where is the port where you can insert and fill it? This is the cover for the port. Okay, so you will have a gap here. You have to lift it up, and this is how you first insert the bottle. Okay, first lift the cap or the cover, insert the bottle like this, and turn the bottle upside down. Then only you can fill this vaporizer. So you can see the three positions. This is fully covered filling port. This is a filling port with a bottle inserted without turning it up. This is the position you adopt to fill the bottle and fill the vaporizer. Otherwise, with this position you cannot fill. So these are the three positions you use. Whereas if you have a vaporizer like this dragger, just got a different mechanism of filling. The cover is like this. How do you fill this? So this cap has to be removed. So by pulling this knob, you can remove this cap, and this is how it will be filled. You can see this cap has been removed here, is hanging, and you just insert the bottle and give a pressure. That will release a spring which is there, and it will start filling, and you can see the amount filled in the sighting glass. Okay, so this is how you fill the vaporizer for this. This is a little peculiar arrangement. Coming to the other features of this drug, solubility has the lowest blood gas solubility, even lesser than nitrous oxide. So 0.42 is the blood gas solubility. The lower blood gas solubility allows the anesthetic alveolar concentration to remain near inspired concentration, permitting a rapid large change. So the induction and recovery of both are very fast. So early induction and early awakening. So this is the duration of anesthesia administration, 90% decrement, that is recovery time. If you see, the Desflurane has got the lowest recovery time, less than 20 minutes. Whereas sevoflurane, all other agents, if you use it for longer hours, the duration they have used is 350 minutes, almost 6 hours. And even after 6 hours of use, Desflurane has got a recovery time of less than 20 minutes, whereas all other drugs have got recovery time which is much more greater. Then potency and MAC has low anesthetic potency, leading to higher MAC values. So the MAC values in 100% oxygen and nitric oxide, they vary according to age. And on the cardiovascular system, effects are divided into two types. The direct effects of the anesthetic response involving sympathetic nervous activation. Desflurane decreases myocardial contractility, cardiac output, and blood pressure in a dose-dependent fashion. Desflurane does not appear to have a specific direct effect on the sympathetic nervous system. The sympathetic activation may arise from stimulation to rapidly adapting upper airway receptors and from an unrecognized systemic arterial site. Beta adrenergic activation leads to significant elevations of BP and heart rate mediated by plasma adrenaline and noradrenaline release. And the degree of sympathetic stimulation related in part to absolute concentration. So the more and rapid rise in. So if you quickly increase the percentage of Desflurane, then you can have a increased stimulation of the sympathetic nervous system. Whereas if you do it in a slower fashion, this is very much reduced. And in the pulmonary system, it is an irritant to the airway. So coughing and breath holding is very common, and laryngospasm also can happen. That is why this is not the agent of choice for pediatric inhalation anesthesia. Sevoflurane is the best because of its sweet smell and smooth induction. And the threshold for irritation seems to be influenced by age, opioid administration, and smoking. So it increases with age and decreases airway response to irritants. So if the patient is a smoker, more so he will have this coughing and breath holding and all these things. Whereas administration of small doses of fentanyl can decrease this airway irritation and make the patient tolerate this better. So if at all you have only Desflurane available, you want to do an inhalation induction, administer a small dose of fentanyl and then you hold the mask, then it is well tolerated. With the use of LMA on awakening, Desflurane provides rapid recovery of pharyngeal reflexes compared to sevoflurane. So for LMA use also, this is very good. Then increasing obesity decreases pulmonary function at 2 hours after propofol, but not after Desflurane anesthesia. This is one of the main reasons why you want to use Desflurane as the agent of choice for obese patients. Neurological system, the cerebral physiology reduces cerebral vascular resistance and increases intracranial pressure in a dose-dependent fashion, which is a common factor for all the inhalation agents. And there is a depression of EEG activity and evoked potentials. And central respiratory depressant activity is also there. And hepatic and renal effects, absence of hepatotoxicity. So that is because minimal biodegradation, sustained hepatic arterial blood flow is preserved, and rapid elimination after termination of anesthesia. So this factor makes it, the sustained hepatic arterial blood flow makes it the agent of choice for liver diseases also. And post-anesthetic renal function show no change after Desflurane anesthesia. Neuromuscular effects, Desflurane produces dose-related muscle relaxation, potentiates ND blockers, and in obstetrics, Desflurane has been used for cesarean section with no significant maternal complications and only slightly longer neonatal time to sustained respirations. Desflurane has been well tolerated when used for labor analgesia also. So labor analgesia, they give sevoflurane in oxygen, CVOX, for analgesia. Similarly, they have tried this also, but again, because of the pungent odor, it may not be the right drug for choice. And Desflurane will be available in brown glass bottles, which are there and for it. In elderly population, faster clear head, so it is good for geriatric patients also. And obese population gain popularity for bariatric surgery because obese patients are a higher risk of aspiration, hypoventilation, airway obstruction, and desaturation. In pediatric population, not approved for induction and maintenance of anesthesia in non-intubated children. So they have not approved this drug for induction or for spontaneous breathing. Caution should be exercised when Desflurane is used for maintenance with laryngeal mask. Children older than 6 years, where coughing and breath holding can happen, whereas in adults it is much less. And especially if you have used opioid like fentanyl, then you can get away with this problem. And in COPD patients, may provoke coughing, bronchospasm, laryngospasm, and bronchial hypersecretion. And but exhibits bronchodilator effect at 1 MAC concentration, but at higher MAC values increases airway resistance. Okay. Dosage, high vapor pressure, necessitate delivery from an electrically heated vaporizer specifically designed for that. 3% Desflurane we started, and then maybe increased 0.5 to 1% increments to every 2 to 3 breaths. So after you put an LMA or a ET tube, you start first with 3%, then gradually increase it by 0.5 to 1%. And of course, all of you may be knowing that the Desflurane vaporizer Tech 6 has got maximum 18% delivery. So from 3% you go to 4% or 3.54, 4.5 like that every 2 to 3 breaths. And there are two techniques. One is called over pressurizing technique. Moving the dial setting in large shifts should be avoided, as Desflurane having a low partial coefficient will achieve desired end-tidal concentration faster. And concentrations of Desflurane exceeding 1 mag may increase the heart rate. So if you suddenly increase it from 3 to 4, 5, 6 within 1 or 2 breaths, then this is called over pressurizing, and that will cause a tachycardia. And surgical level of anesthesia is obtained with 2.5 to 8.5% concentration in the dial. Because of minimal metabolism, need for dose adjustments in renal hepatic patients is not expected. So you can use it at the same concentration even in patients with CKD or hepatic disease. And use of Desflurane is contraindicated in patients with malignant hyperthermia. So this is also an agent like halothane which can trigger malignant hyperthermia. So don't use in a patient who has a family history suggestive of MH. And faster emergence and extubation, which is more predictable, reducing the variability of extubation time, can have significant effect on indirect cost, because you are going to recover the patient faster. The total cost of anesthesia may come down because the patient will leave the theater faster. So the operative time will be less, and post anesthesia discharge also happens faster. So from economic point of view also, this is a better agent. But this is a very, very strong objection for using this. The global warming potential, which we saw in our class on environmental sustainable anesthesia, Desflurane produces the maximum amount of environmental pollution or heat, 6,810 compared to 1,800 for isoflurane and 440 for sevoflurane. So this is not environmental friendly at all. That is one of the biggest disadvantages of this particular agent. Okay, so I think you can add all these points to your answer, then it will be more complete. Okay.